Good evening, Mr. Johnson.
Good evening.
My name is Anne Marie. I'm your student nurse today. I'm here to do your head to toe assessment. Is that okay?
That's fine.
All right. Before I begin, let me drape the curtain so we have privacy, as well as I'm going to wash my hands and get my supplies. All right. So before we begin today, can you state your full name and date of birth?
Full name is Brian Johnson.
Mm-hmm.
Date of birth is 12/21/1959.
And do you know what today is?
It's Thursday.
Thursday. Very good. Are you having any problem with pain in any part of your body?
No.
Any weakness?
No.
Any shortness of breath?
No.
Okay, so this assessment, as I said, you are going to assess your head and neck. We're going to assess your lungs sounds. We're going to assess your heart sounds. We're going to listen to your bowel sounds, as well as we're going to be doing inspection, and you're going to do a neuromuscular check as well.
All right.
All right, it's going to take about 20 minutes. If at any time you feel any pain or discomfort, please let me know.
Okay.
Okay? All right, so I'm starting at the head, and I'm just going to check your scalp. And I see the skin is intact. Is there any tenderness?
No.
Okay, good. All right, next I'm going to check your eyes, and I'm going to use my pen light, and I'm going to check your pupils. I'm going to check each one. Okay, good. And I see that the pupils, they are round, they're equal and reactive to light and accommodation. I'm going to check the conjunctiva. So let me pull your eyelids down. The conjunctiva is clear. The sclera is white. The cornea is shiny. And the irises, the color is even in both eyes. Next, I'm going to look at your ears. And I'm checking the, can you turn? Checking the external structure. And I see that there's no skin breakdown. Are you having any tenderness when I pull?
No.
And on the inside, there's no drainage. I'm checking on the other side. Do you feel any tenderness?
No.
Okay. On the outside, the external ear, there's no skin breakdown. There's no drainage on the internal ear. And I'm also checking your auricular sinuses. Do you feel any tenderness there?
No.
Very good. Okay, so next I'm going to check your nose. And I see that the nose bridge is at midline with the rest of your body. Let me check the nasal mucosa. There's no drainage. There's no lesion. Do you feel any tenderness up there?
No.
Good. All right. Next I'm going to check your facial nerves. So I'm going to ask you to, can you smile? Clench your teeth. Puff out your cheeks. Stick your tongue out and move it from side to side. Wriggle your forehead and clench your eyes. Good. And now I'm going to check for your maxillary sinuses. Any tenderness?
No.
In the frontal sinuses. Any tenderness there?
No.
Okay. Now I'm going to check your mouth. Now I'm getting my tongue blade. Can you stick your tongue out? Say in. Can you say ah?
Ah.
Lift your tongue to the roof of the mouth. Okay, so I see that the teeth are in line, aligned. The lips are moist. There's no lesion noted in the gum line of the mouth. There's no redness, and your vulva and the palate was at midline and was able to move up and down in up and down direction. I'm now checking your neck, and I'm palpating your cervical lymph nodes. Any tenderness?
No.
And I'm checking the carotid pulse on each side. Any tenderness there?
No.
And the sinuses were palpable. Okay. So next, I'm going to check for muscle strength. Can you move your shoulders up, down? Okay. Can you move the force of your head on my hand on the back? Okay. So the patient was able to move against force without resistance. There was good muscle strength demonstrated from the shoulders. The shoulders are symmetrical. Mr. Johnson appeared clean, he's pleasant, he's alert and oriented times 4. He was able to answer questions that were asked and communicate appropriately. All right, so now I'm going to move to the chest area, and I see that the color of your skin is even. It's appropriate with your ethnicity. There's no skin breakdown, and I'm checking your auxiliary lymph nodes. Any tenderness?
No.
Good. All right, so I'm going to listen. I'm going to clean my stethoscope, and I'm going to check your lung sound. I'm going to ask you to breathe in and out, and I'm going to be listening at each inspiratory cycle. So in, out, in, okay, lung sounds are clear. I'm going to ask you to turn around, and I'm checking the back. And while I'm checking the lung sounds at the back, I see that Mr. Johnson's skin is intact. There's no redness or lesion. I'm going to ask you to breathe in and out again. I'm going to ask you to put your hands to the side so I can check the lateral. Okay, good. You turn around. Okay, so Mr. Johnson, the lung sounds were clear in all fields. No crackles or murmurs were detected. Alright, so next I'm going to move to listen to your heart sounds. I'm going to come on this side. I'm going to start. Now you can relax and breathe normally, okay?
Okay.
I'm going to start at the aortic area, and I'm going to listen for 1 full respiratory cycle. Now at the aortic area, at the second intercostal space below the clavicle. Go to the left intercostal, second intercostal space on the left, and this is the pulmonic area. Then I move down to the Erb's point, and this is at the midline. This is where the apex and the base is separated. And then I move to the tricuspid area. And then to the mitral area. Okay. And Mr. Johnson has the heart sounds were without murmur. They were even spaces on the S1 and S2 heartbeats. All right, next I'm gonna listen to your bowel sounds. So I'm gonna ask you to move over to the bed. And I'm gonna move the camera. So I can see. So I see that that Mr. Johnson's abdomen is rounded, the skin is intact, clear and smooth, and I'm gonna be listening to the bowel sound in all 4 quadrants. I'm gonna start at the right lower quadrant. Breathe in, out. I'm at the right upper quadrant. And let's do the left upper quadrant. And to the left lower quadrant. And they were clear vowel sounds. Next, I'm going to palpate for any tenderness or any lesion, hernia. And I'm doing light palpitation, 2 centimeters deep. And I'm going around the 4 quadrants. Any pain?
No.
Or any tenderness?
No.
Okay, I'm going to go deeper at 4 centimeters. Do you feel any pain?
No.
Okay. All right. All right, so I see that Mr. Johnson's, yes, clear, normal vowel sounds. There were no mass or tenderness detected. His umbilicus is at the midline. Mr. Johnson's umbilicus, I said, is at the midline. There were no mass nor any tenderness noted. He had normal vowel sounds. Alright, so now we're gonna do your neuromuscular check. So I'm just gonna ask you to stand. And I'm gonna ask you to walk normally. Mr. Johnson is able to maintain posture, good gait. Can you come back on your heels? Walk on your heels. On your toes. Good. Alright, you can stop there. Mr. Johnson was able to maintain balance on both heels and toes. I'm going to ask you to bend over and touch your toes. I'm checking your spine. And I see that the spine is aligned. The shoulder is symmetrical. You have good balance. Can you close your eyes for me? Put your hands beside you. I'm going to do the lumbar test. This is to test for balance. Okay, so close your eyes. And I'm ensuring that Mr. Johnson's safety. Okay, you can open your eyes. Okay, next I'm going to ask you to sit back. Oh, before we sit, I'm going to let you do your range of motion. So you're going to bend forward, checking your spine, backwards, side, next side. Very good. Alright, so I'm going to ask you to sit now. And I'm going to ask you to do your heel to shin movement. Rub your heel down your shin. Very good. Alright. And then I'm going to test for sensation. But before I do that, I'm just going to ask you to, I'm going to check for your fine motor skills. So you're going to touch your nose and touch my finger. Again. Again. Very good. I'm going to ask you to perform rapid hand movements. So let's go. Very good. All right. Thank you. So now you're going to close your eyes for me. And I'm going to be checking for sensation. Let me know if you feel. Okay? Do you feel that?
Yes.
That one?
Yes.
Do you feel here?
Yes.
And here?
Yes.
Do you feel here?
Yes.
Do you feel here?
Yes.
Okay. And your foot?
Yes.
And this one?
Yes.
Okay, very good. All right. So Mr. Johnson, we forget to do one assessment, and that is a cardinal field of gaze to check for cranial nerve 3, 4, and 6. So I'm going to hold this pen. It's 12 inches apart away from your nose. I'm going to ask you not to move your head, but to use your eyes and follow the pen, okay? All right? And I'm going to be checking bilaterally. So, don't move your head. Okay, so Mr. Johnson was able to demonstrate the 6 cardinal field of gaze by using his eyes to follow my pen. Okay. All right. I think that concludes our assessment for today. Do you have any difficulty, any pain, any
No.
discomfort?
No.
Okay. All right. Thank you so much.
Thank you.